Please put your hands together and welcome to the stage Dr. Clarence B. Jones.
Oh, freedom, oh, freedom, oh, freedom over me. And before I'll be a slave, I'll be buried in my grave and go home to my Lord and be free. Fyodor Dostoevsky, in his classic work, Crime and Punishment, says that there are three ways in which you can measure the value of a society. You look at how it treats its inmates in prison, how it treats its older people, and how it treats its children. And I would add how it treats its children and undocumented persons. So I am so glad to be here. My, I never thought. Where's Sean? He has to refresh my recollection. I never thought that, I don't know how many years it's been, but God Almighty, I'm 93 years old, standing here, and you don't have to tell me, I know I'm beautiful. So I'm 93 years old and standing. Well, what's more important is not that I am beautiful. What is more important, that you are beautiful. And that I must be doing something right to be blessed to be with you here another year. That's some deep stuff, brothers and sisters. Thank you. So let me get out of the way and let your program begin. Thank you so much.
And now, welcome your Jones Award judges to present this year's award.
Thank you, Dr. Jones. I have to say, it is just as humbling to share the stage with you this year as it was last year, when my whistleblower aide colleague, Libby Liu, and I had the honor of accepting this award. And being here inspires me beyond measure. It's not just the work we all do, it's the passion and commitment behind the work that makes the crucial difference. That's true of you, Dr. Jones, and it's true of all of you in this room. At Whistleblower Aid, we represent whistleblowers in the public and private sectors. We have spent the past year building partnerships, traveling around the country to let everyone in the elections business know, from frontline poll workers to secretaries of state, that they can blow the whistle safely, legally, and responsibly if they experience or witness any wrongdoing before, during, or after the election. Yes. Because we know in this room and beyond that it is our mandate to safeguard our democracy. And I know from my conversations with many of you that you share a very similar determination. I can feel the energy here at ComNet. You are doing the hard work to make our country a stronger and more equitable place. It is now my honor, on behalf of this distinguished panel of badass judges, to introduce this year's Clarence B. Jones Impact Award winner. It's an organization I'm very familiar with as a Californian, as an Angelino, and as someone who is passionate about fighting for those who flee their home countries to pursue the American dream, just like my grandparents did decades ago. I've been a great admirer of their work for a very long time. Everyone, the California Endowment.
Good morning, ComNet.
Good morning.
Thank you so much for this honor. We at the California Endowment are excited and humbled to be recognized for telling the community's brave and incredibly resilient stories and the importance of ensuring health. Thank you to the judges, and thank you to ComNet. It is an honor to be in the presence of former award recipients, and of course, Dr. Jones, a true hero that stands among giants. This has been a team effort of current and former TCE staff, and we are really excited to have our communications team here with us today. Please stand.
Stand up. Stand up. Like all communication staff, they don't like taking the credit. Today, you will hear the success story of a communication campaign that has evolved over 10 years. It's been a long campaign filled with wins and, yes, some challenges. And that journey continues today. We hope that sharing our story can provide all of you just a small nugget of helpful information.
We are not afraid anymore. We're undocumented, unafraid. We're gonna blow the air. Health for all. Health for all.
Human beings should have the opportunity to be healthy.
I believe in health for all.
Healthcare is a human right. Servicio médico para todos.
Health for all. Health for all. Tomorrow we continue the work and the march forward to health for all.
This is where the story begins, but we have to do a commercial first. So we just want to tell you a little about our foundation, the California Endowment. We are known as a conversion foundation, established when Blue Cross went from public to private. TCE, as we call it, is the largest health foundation in California and one of the largest in the country.
And even though the two of us are here presenting, we certainly didn't do this alone. This is the work of many organizations, partners, residents, community leaders, advocates, philanthropic partners, and undocumented Californians who share their stories, and so many others who have made Health for All what it has become. This award is dedicated to each one of you, and some of you are likely in the audience today.
Today, after all the votes have been tallied, health insurance reform becomes law in the United States of America. We are done.
That was a historic day and a huge moment for the nation. And yet, undocumented immigrants were intentionally left out of this legislation. For them, there was no celebrating. Undocumented youth were challenging this new reality. They asked a very important question out loud. Did everyone really mean everyone?
I work, I pay taxes, and I'm undocumented.
Doesn't it make more sense to keep us all healthy instead of treating us after we get sick?
I dream that one day, today,
everyone will include me.
Everyone will include all of us.
because health happens when we dream together.
I'm undocumented. Soy indocumentada.
I'm undocumented,
but I dream that one day
we'll all be treated as one people.
Because we are all one people.
We work hard.
And we're strong.
But everyone gets sick sometimes.
And yet many of us don't have health care.
Cannot get health insurance.
Now our country has spoken,
saying that everyone should have affordable health care.
Does that mean everyone?
I dream that one day,
everyone will include me.
Everyone will include all of us.
All of us. Because health happens when we dream together.
It was clear to us that a segment of our population was being pushed into the shadows and excluded from the opportunity to have health care. That didn't sit well with us and our partners. It was contrary to our values of equity and inclusion. We were ready to fight for the change that was needed, but we couldn't start a conversation about expanding access to health care for the undocumented when they were being othered. We needed to change the narratives about how our undocumented communities were being talked about and portrayed.
The community that was directly affected had to lead and be front and center. And as you know, for a foundation to listen, learn, and let others lead can be tough. In philanthropy, we often think we know everything. But listening is key in communications. This was not our story to tell, and we had to respect that and honor it. So we let our community lead.
A powerful and unprecedented partnership came together between young, undocumented leaders, immigrant rights, and health advocates. Young people shared their story. They called themselves undocumented and unafraid. And they began to challenge California to do the right thing. We at the California Endowment were all in. We brought to the table all of our resources, including digital and traditional media. The goal was to highlight the experiences and the voice of immigrant youth across the state. But we had one big challenge right at the start. We didn't know how to talk about the undocumented community. So we conducted message testing with undocumented Californians. It informed our messaging and ensured authenticity.
Then we conducted a voter poll with a bipartisan team of pollsters. It helped us identify messages that resonated, and those messages were echoed throughout the campaign. The poll showed that a slim majority of California voters backed the idea of making health coverage available to all. It also showed that other Californians could be convinced, so we got to work on our messaging. We learned that the concepts of increasing access to preventive care, reducing emergency room costs, and improving public health resonated. So we made those points focal to the campaign. The message testing helped us strengthen our message and identify messengers. We needed to communicate with the general population, undocumented communities, and decision makers. However, the messaging for each of those groups needed to be tailored to resonate with each one of the audiences. It goes without saying that a one-size-fits-all approach would certainly not work here.
As communication professionals, we knew that words matter and can harm what we are hoping to achieve. We had to get everyone on the same page, Not such an easy thing to do at times. And we had to get them comfortable with what we would communicate. For us, this meant, again, letting the community lead. We communication professionals needed to be in a listening mode. We followed undocumented youth. They led us, not vice versa. They used the term undocumented California, and we are all Californians. Young, undocumented youth even coined the phrase, "I wasn't born in California, California was born in me." These were the authentic voices of young people, not a tagline, no offense, of a consultant. Just wanted to say that, no offense. Their choice of words clearly countered the terms often that we saw in the media, illegal. We wanted the media to move away from that term.
I have been here since I was 3 years old. I don't know any other place but this to be my home.
To this day, I have my parents really to thank for their support.
My earliest memories are playing in the backyard of this really tiny little garage store. My parents have done a lot and sacrificed a lot.
It is ironic the fact that my parents themselves won't be able to see me as patients, if I were to become a doctor tomorrow.
We are part of the society. We've grown up here. The ability to see a doctor and be treated should definitely be open to everybody in California.
Sickness doesn't discriminate. As contributing members of this state, this community, we should be able to access the same health insurance as citizens.
I wasn't born in California, but California was born in me.
So as you can see, we developed organic content with young people. We crafted a distinct visual identity and a hashtag that engaged diverse audiences. We promoted a consistent message, and we were always checking back with our young people and our community partners. Early in on our strategy, we were intentional about our different audiences, and we targeted our messages and tactics accordingly. Some of the tactics we deployed were intended to empower and energize our undocumented communities in California. We needed to ensure that they saw themselves in the campaign, and we also wanted to raise public awareness about the issue and the people impacted. And we also wanted Californians to energize to get involved. Our tactics included several media tools: billboards, bus shelter ads, murals, rally signs, T-shirts, videos, op-eds, and radio. And we also ran ads in unusual locations such as convenience stores, laundromats, and taco trucks. These are places we knew our audience frequented, and we wanted them to see the message.
We also had to reach a real key audience and get their attention, policymakers. We set up a display at the state capitol rotunda of stories of undocumented young adults. We worked with influencers, including San Francisco Giants pitcher Sergio Romo, who at the time was a relief pitcher for the World Series Giants, who were champions, World Series champions. He made a strong statement on behalf of the immigrant communities by wearing a T-shirt, "I just look illegal." Let me tell you, enlisting Sergio Romo into the campaign was a home run. No pun intended, but it was a home run for us and the campaign.
To get the attention of a more mainstream audience, we also worked with Hollywood writers. Through a grant to the USC Annenberg School of Communications and Journalism, we educated writers about the issue. Once the writers heard about how real and heartbreaking the issue was, they actually wrote a Grey's Anatomy episode that highlighted the struggles of undocumented people. The plotline focused on how undocumented families delayed seeking health care because of fear due to their immigration status. We highlighted the show and its message through our social media platforms and other sources, Let's take a look.
Grey's Anatomy approved a storyline that was going to tell the issue about the struggles of a mother who, because is undocumented, is afraid to take her daughter in to have medical treatment done. And by the time that she takes her daughter into the ER room, her daughter is suffering from a tumor.
Looks like a mass, and there's free fluid.
Yeah, that's the size of a soccer ball.
No, you can't do that. You don't understand. We have no papers, undocumented. They're going to help you.
There was constant strategizing and leveraging of every opportunity to echo the message of Health for All through events, sponsorships, earned media, and research partners that published reports highlighting the number of people who remained uninsured and were undocumented. Again, using every tool in the toolkit, the campaign finally caught the attention of policymakers.
We knew that ultimately this issue would require a policy change. Yet we didn't know going into this campaign whether it would be possible to accomplish it. We didn't have huge budgets, so we knew we had to use every resource wisely and hit our targets as accurately as possible. TCE certainly took a chance on this campaign, not knowing if it would be successful. We were very lucky, however, to have the support of our board, leadership, young people, and our staff, who's also very passionate about this issue. Some of us are immigrants, formerly undocumented immigrants. We are a foundation that lives on the edge when it comes to social justice and issues of inclusion and equity. We recognize that this may not be the case with every foundation and organization, but it certainly is a conversation we should all be having in philanthropy. So the first bill was introduced in the California State Legislature in December of 2014. It aimed to expand Medi-Cal eligibility to everyone in California, regardless of immigration status. However, that bill died in the legislative process. Yes, it took the wind out of our sails, but not for long. It didn't stop everyone involved, particularly the young people and our partners.
The purpose of this bill is actually quite simple: to expand healthcare coverage in California to include everyone who is currently excluded from participating. And I want to emphasize that an investment in immigrant families is an investment in our state.
I got assaulted and beat down to the ground by two men. When the police came, they asked me if I want an ambulance. And without any hesitation, I gave them a firm no. At that moment, I was more worried about the stress of not having health insurance than my traumatic experience of being assaulted.
My treatment would be costly because Medi-Cal didn't cover the costs. The low-income clinic told me on the second appointment not to worry. She knew that there was people with lumps growing within their body and they lived a full life.
Deben imaginar hasta qué desierto me llevaron esas palabras.
If sickness doesn't look at you and tells you because you're undocumented, you can't get sick. It should be the basic human right to get education, to have health care, to go to the doctor just because you need it or you need to get a regular checkup. We gotta set aside racial colors, standards, and view each other as brothers, humans, because that's what we really are.
We started to see progress and success in 2015 when California expanded access to Medi-Cal to undocumented children.
Our strategy and communications plan had to evolve all along the way to reach the families and implement the policy win. Our goal in this campaign phase was to use enrollment efforts and communications to spread the word across the state. We kept returning to that toolbox. We used ads, radio, video, and earned media. But most importantly were our trusted partners on the ground. They provided outreach and assistance in language to encourage enrollment into the program.
And just as we thought we were making progress, 2016 happened. A national anti-immigrant narrative, sentiment, and federal administration brought on additional challenges. It was another blow to the campaign and to our immigrant communities. Families were fearful about enrolling their children in government programs. Various anti-immigrant policies were being pursued, including public charge, and that created a chilling effect. The campaign messaging, again, had to evolve to respond and address the fears. We had to reassess our approach and not be let down by the noise of othering and anti-immigrant sentiment. We knew through polling data that the voters were with us. This national landscape actually refueled our campaign and our fight. California remained firm and strong in its values of inclusion and equity, and was a leader in resisting damaging policies.
Throughout this process, we continued to assess the plan, strategies, and results. A public opinion poll showed that support for immigrants has increased over the years. In fact, if you look at this slide, according to a 2021 Public Policy Institute of California survey, the public support for inclusive health coverage grew to 66% of adults supporting coverage for undocumented immigrants, up from 54% in 2015. In 2024, 69% of adult voters positively perceived immigration, according to this survey. Polling data is important. It gives us an indication of the impact. As communicators, the impact of the campaign is not easy to measure. We all know that. And a public opinion poll can help us see whether or not we are moving that needle.
And the needle did move. It took several years, but in 2020, California took the next step and expanded Medi-Cal to all young adults under the age of 26. Then, in 2022, undocumented older adults over 50 gained access to Medi-Cal. And in January of this year, access barriers for undocumented Californians were completely removed as all adults between the ages of 26 and 49 became eligible for Medi-Cal, regardless of immigration status. After all that work, dedication, and persistence from the community, California achieved the largest expansion of Medi-Cal since the Affordable Care Act. California was the first state in the nation to enact a law to expand Medi-Cal to everyone, regardless of immigration status. And finally, the dream of inclusion was realized. Our undocumented community successfully achieved its dream of health for all.
But the work doesn't stop there. We stopped celebrating for a while, but we had to get to work. We needed to get folks signed up. Once again, the strategy and the communication plan evolved as we tried to reach different age groups each time a bill was passed. We strategized on how to get the word out. Successful implementation would be critical to make the policy real for our community. There were very early conversations with partners on the ground. This time we worked closely with our sister foundation, the California Healthcare Foundation. They are one of our partners in justice. We both wanted to collaborate to support outreach, education, and enrollment. We had to learn how many to reach, where they lived, how to reach them, how to make them feel safe, and what would work.
So for this phase of the campaign, CHCF did research and focus groups. We at TCE used that information to develop campaign assets. We worked with government partners to enlist a trusted messenger, California Surgeon General. In working with the state, we also ensured the accuracy of technical information. The state also created a one-stop consumer-friendly website to direct people to. From focus groups, we heard that people really wanted a .gov landing page to get information and enroll. We deployed resources jointly, and in an unprecedented fashion, we co-funded paid media and we resourced organizations on the ground to do the outreach, education, and enrollment. It was the first time the two foundations deployed a campaign together in which we at TCE created the assets using the information from the CHCF focus groups, and then co-branded the campaign videos and jointly funded the media buys using the same assets. It was a very successful partnership because of trust. We had built trust through constant communication along the way. And it was also a great way for both of our organizations to increase the impact of our dollars.
Hello, I'm Dr. Diana Ramos, California Surgeon General. Starting in 2024, health coverage will expand to everyone, regardless of immigration status. Enrolling will not affect your immigration status.
Medical ya está disponible para todos, sin importar su estatus migratorio.
Quiero decirles que California ha ampliado el programa de Medi-Cal. Si usted es indocumentado, podría calificar. El programa es gratis o de bajo costo.
I'm excited, and yes, very relieved, to say we were successful. We reached our audience, but we needed to track the results, and as many of you know, that doesn't mean just tracking impressions. We needed to know if the engagement and actual click-through rates to the designated site worked. If you look at this slide here, I'm glad to say it did.
And similarly, the number of enrollments surpassed expectations every single time. Look at these numbers. A lot more people enrolled in the program than initially estimated in each one of the age groups. For example, the state estimated that 90,000 young adults were eligible, but as you can see, over 130,000 have enrolled thus far, and probably more will come soon. While we celebrate these wins, we also know that there's still a lot of work to achieve a fully inclusive healthcare system. This campaign not only contributed to a large number of enrolled and documented adults and children into healthcare, but also inspired other campaigns, such as Food for All, Parks for All, and others. For us at TCE, the work doesn't stop here. We are determined to stop the othering going on and ensure that we change the narrative to one of belonging and building an inclusive, equitable California and beyond.
And I have to say, the numbers that Marisol mentioned, we surprised the state. They were like, how many have been enrolled? We do all of these, we do that with all the lessons that we learned from Health for All. Here's what worked for us, and they might work for you. So, number one, always listen to community. Number two, remember, it's not our story to tell. Number three, always empower underserved communities. And when possible, work with trusted messengers. Number five, campaigns like this need long-term sustained funding. Build excitement and acceptance around the issue. And finally, know that the job is never done. Being bold, we walked all the way to the edge, and now undocumented Californians who are eligible for Medi-Cal can enroll.
La lucha sigue.
The struggle continues. Thank you.
Thank you so much.
Thank you.
Thank you.